When we look at smooth muscles, they can be divided into single unit smooth muscle fibers and a multi-unit smooth muscle fibers. Now there are only key differences that single unit smooth muscle fibers has interconnecting gap junctions. These gap junctions allow rapid spread of the action potential throughout the tissues. Hence, all the muscle fibers show synchronous contraction as a single unit. Multi-unit smooth muscle fibers are without these interconnecting gap junctions. Hence, single stimulus causes a repeated firing of action potential which produces a irregular tetanic contraction. And these resemble such as skeletal muscles. Now, single unit smooth muscle fibers are found in the GI tract or uterus. Multi-unit smooth muscle fibers are produced or found in blood vessels, ciliary of eye. Coming to its electrical properties, so there's unstable membrane potential seen in these smooth muscles. That is, the membrane potential has no true value and is relatively low when tissue is active, and it is high when the tissue is at rest. Now the resting membrane potential is minus 50 millivolts and minus 75 millivolts. It is low because intracellular concentration of sodium and chloride is high and the potassium is relatively low. Now the initiation of spontaneous activity begins with calcium influx and the sodium influx. The electrical properties are excitability, extensibility, elasticity, contractility. There are superimposed waves starting with slow sine wave like fluctuations, which is the most common type, and these are few millivolts in magnitude and its spikes overshoots the zero potential line sometimes. And there is this tissue spike duration that is approximately 50 milliseconds. And in some tissues, the action potential has prolonged plateau during the depolarization. Now the spikes may occur in rising or the falling phase of the sine wave. There is pacemaker potential that is generated in the multiple foci that shifts from place to place. Spike is generated in pacemaker foci and are conducted for some time or some distance in the muscle. Hence, the action potential are superimposed over rising phase, present in visceral organs such as intestine. Next, the action potential with plateau. So, action potential starts with strong, rapid depolarization similar to our skeletal muscles, but then there is no repolarization immediately. This type of action potential here is responsible for the sustained contraction of the smooth muscle fibers. Next we see tonic contraction without the action potential. Smooth muscles of some visceral organs maintain a stable partial contraction called as tone. Now due to the tonic contraction of muscle without action potential is seen, that could be due to actions of the hormones. Now in smooth muscles, the depolarization occurs due to the opening of calcium channels and the entry of calcium ions. These calcium channels are slow, which is responsible for the plateau and the prolonged action potential. In the multi-unit smooth muscle fibers, with the androgenic excitatory discharge, stimulation of androgenic nerve is seen that produces discrete partial depolarization known as excitatory junctional potentials, and they summate with the repeated stimuli.